Assalamu alaikum wa rahmatullahi wa barakatuh. Abdurrahman, you can start.
Yeah. Assalamu alaikum wa rahmatullahi wa barakatuh, brothers and sisters. Thank you for joining our podcast, season 2 today. Today we're going to talk a little bit about vaccines and whether they're safe. How good is it for your immune system? And in particular, can COVID vaccines be trusted? About the Doc Talk itself, our Doc Talk aims to bring to you about authentic medical information on a range of topics. And in this podcast, we will share information related to common medical conditions and how to seek treatment for them. We will bust the myths and empower you with facts. We intend to bring together specialists, doctors into your home and equip you with better care for your family. I'd like to provide a brief introduction about our panelists today. We have with us Dr. Asif, and we've got Dr. Nabil and Dr. Sundus with us. Dr. Asif Ali has qualified from the Guy's, King's and St. Thomas's Medical School in London in 2002. He's been a GP principal at Langley Health Centre since 2006 and currently manages 2 practices across Slough and Windsor. He's currently a GP trainer at Oxford Deanery and an appraiser at NHS England. He's also named the named GP for safeguarding children in Berkshire East. Dr. Asif has held various management roles at the NHS, including Medical Director for Community Health Services and CCG Board Director. Currently, he is a Clinical Director for the Slough LOCC Primary Care Network. Dr. Asif is also very active in educating the Muslim parents about vaccination for many years. Our second panelist for today is Dr. Nabil. And Dr. Nabil is an emergency physician from Chennai in India. Currently, he's pursuing a fellowship in University Hospital Southampton in the UK. He's worked in the COVID ICU the last year and currently works in Children's Emergency Department. Our third panelist for today is Dr. Sundus Javad. She is a multi-award winning pharmacist with interest in quality improvement, patient safety, and care of the elderly. She is involved in the rollout of first COVID-19 vaccines to care homes in UK. She is also the lead pharmacist for Medicines Optimization Care Homes, the NHS East Berkshire CCG. In addition, she is also an associate medicines at National Institute of Health and Care. Dr. Sundus has over 20 years of experience working in primary care in the UK. Dr. Sundus will answer the questions via the chat room, and I request the audience to post questions in the chat after about 30 minutes once the initial topics are covered. So moving on to our talk right away, Dr. Asif and Dr. Nabil, you've seen the COVID-19 over the years, and you've been in the front line, meeting so many patients, and well, it's been quite a tough year. And finally, we've seen the light of day for vaccines, which is great news. But at the same time, there's a lot of myths, and a lot of us are plagued with the idea that vaccines can be evil stuff, or that, there are too many conflicting reports about the content of various vaccines. Which one will work? Does this variant work in India, for instance? Such myths exist, and we'd love to hear your views on this topic. So let's try to do a quick recap. Dr. Nabil, you've seen the ICU experiences of patients who've been in pain over the year. Can you share a few of these experiences to summarize where this leads up to for the vaccine?
Thank you, Abdurrahman, for introducing us, and thank you for hosting us as well today. So, alhamdulillah, wassalatu wassalamu ala rasulillah. So I remember last year we spoke about this. We had a doc talk on this, on COVID. It was quite an experience, I would say, and it seems like a long time now, a big journey through COVID. But, to summarize, I would say that this is something we have been sort of dealing with unlike anything before. And from the hospital viewpoint, this is something which is unheard of in their lifetime. So it was quite a challenge to see loads of patients in ICU overflowing, and the staff, the family members, the general public, there was so much panic around everyone. It was quite a difficult thing in the sense, the thing around all of this was there was this social media impact that was there all around. Everybody knew pretty much what was happening very quick compared to what you would probably expect in decades ago. But at the, it was a double-edged sword. At the same time, false news and false information and a lot of misinformation was shared as well. That made life really difficult for a lot of countries and communities to deal with. And even regarding the actual work in the hospital in itself, I would tell you that even in the recently, a few weeks ago, Dr. Asif might be knowing, despite all the pressure in the hospital, there were few people who took to social media saying there wasn't much happening in the hospital at all. There were a few conspiracy theorists, and there were a few people who were trying to spread the wrong sort of the message. But the reality wasn't so. The reality was that the wards and the ICUs were pretty much full, and even in the community, I'm sure Dr. Asif will share more about it. It was completely sort of jam-packed with loads of patients during the peak. So it has taken a toll on lives, on families. Every admission, even if that be one person who's getting admitted to the ICU, that one person is related to so many other people, individuals in the society. Okay, and it takes a toll on their family, on their daily life, and on various other aspects. So that would be my summary, to say that it was really a difficult situation. And alhamdulillah, we in the UK are slowly coming out of it, the looks of it. Also in India, from what I see, many of your audiences are from India and in Middle East. They have reasonably sort of have a controlled environment at the moment, but there are still cases here and there in many places. I'd like Dr. Asif, you can add on if you think there's something.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, salatu wassalam. All the listeners from the UK. I know we've got brothers and sisters from India and the Middle East, and I think it's afternoon there now. Thank you for joining us this morning. We've all had, within the health service, extremely difficult year. I share a lot of the experiences Brother Nabil mentioned. But I think we've reached a point now, inshallah, there's hope for the future with vaccinations to get us out of this calamity that struck many countries across the world. We've had, subhanAllah, situations where we've lost lots of doctors from the BAME community. One of my ex-colleagues, he was a 75-year-old GP. He sadly passed away over the COVID pandemic. And I've had lots of colleagues being admitted to intensive care as well. So it has affected all of us personally. So this vaccine topic is extremely timely, and I think it's important we discuss this in detail today to give people as much information. Now, there's lots of information out there. As Brother Nabil mentioned, we had people saying that we were making about COVID rates and that the infection was on social media with empty wards and corridors, and this, subhanAllah, was completely false. I even had, I remember about two weeks ago, I went to purchase a vehicle from a car showroom, and the brother that, sorry, brothers and sisters, could you mute yourself if you're not talking? I had a brother who was serving me say, brother, is the COVID infection actually real, or is this just all made up? And subhanAllah, even a year on, some people are still thinking that the whole thing is made up. And I can tell you for sure from a personal experience, I got infected with COVID-19 myself, and I developed chest tightness and breathing difficulties. This was in the first wave of the infection. And I can tell you it's a real infection. And subhanAllah, nobody really knows the level in which people will get affected. We've heard stories of 20-year-olds, 30-year-olds being admitted to intensive care and sadly passing away. We've heard 70, 80-year-olds recover. So this is all in Allah's hands, how the disease progresses and who it infects and how badly it infects. But I think our role as individuals and as medical professionals is to listen to the information at hand and make an informed decision. We know that Prophet ﷺ told us that for every disease, there's a cure. And I firmly believe that the vaccinations are a cure for this infection that's struck us in all over the world. So see it as a cure, but it's not compulsory, and each one of you needs to make an informed decision what's right for you and your loved ones. But certainly today, this morning, just listen to the discussion and weigh up the arguments for yourself and make an educated, informed decision. I'm happy to go into more detail, Abdul Rahman, as and when you want me to.
Thank you, Dr. Asif. That was really amazing to hear the quick recap from your perspective. Wanted to have a natural follow-up on this. When you talk about vaccines, we're talking about active versus passive immunity and the disease process. How does this lead to vaccines being developed and the need for vaccine? Can you explain a bit of that?
Yeah, of course. So, subhanAllah, the creation of Allah is supreme. The intricacies of the human body is absolutely amazing. So the body has what we call B cells, which produce antibodies to infections. And this is the body's natural immune system that protects the body from repeated infection. And we call that active immunity. And in some infections, for example, like influenza or the common cold, you may encounter the virus and your body mounts an immune response against that virus. And we call that active immunity because it then produces antibodies to protect you from that infection. So that's active immunity. Passive immunity is the immunity that you get from another means. It doesn't involve you being infected with the virus. And this traditionally comes from the mother to the baby. So, for example, if the mother's had chickenpox, the fetus will get antibodies to the chickenpox virus. And subhanAllah, this is an amazing way of protecting the baby in the early months and years of the baby's life. And we call that passive immunity. And then the other type of passive immunity is artificial immunity, where you inject the antibody into the body. And that's an artificial way of having antibodies. So let's go back to active immunity. Now, the way active immunity and vaccines work is that rather than expose the body to a virus, not knowing how you respond to the disease process, you then give a vaccine which essentially simulates the active immunity process. So it makes the body think that you have the infection. So let me run through some examples of that. The virus we call the antigen, and the body's immune response we call the antibody. So the antigen, which is the virus, vaccines have to be what we call weakened form of the virus. because you wouldn't want to infect somebody with the actual virus, because that could lead to a full-on disease process. So there's many vaccines available, and each one works in a slightly different way. So for example, you have something called an inactivated virus. So this is traditionally the vaccine for the influenza virus. It's called the inactivated virus. And this is a virus that doesn't cause what we call a pathogenic reaction from the body. It doesn't cause an actual disease or an infection. It makes the body believe that you've got the flu virus in your system, and that causes the antibody to be produced. The other type is called the live attenuated virus. So for example, there's something called the shingles vaccine, which is a live vaccine, and that makes the body think that you've got a shingles infection, and then that mounts the immune response. But it's a attenuated form of the live virus, i.e. a weakened form. So you don't get a full-on disease process. Now, if we extrapolate that into the current topic in hand, which is the COVID-19. So there's several ways of getting immunity to the COVID-19. You can either get infected with the COVID-19, which many people were in the first wave of infection, which started early on in 2020. Like myself, I got infected and I had the antibody test in the summer, and I had antibodies, alhamdulillah. So that's that means that I have a level of protection. Those that a weakened immune response, or in some people where you've got initial antibody response, but over time, the antibody level diminishes so that you no longer have protection, then this is where the COVID-19 comes in, that it makes your body produce an active immune response to that. Now, in terms of the COVID-19 infection and vaccines, there's three types of this. The first type is where you inject the spike protein of the COVID-19 infection into the body, and that's the antigen, which then essentially means the body mounts an immune response to that and produces antibodies, and the antibodies stay in your serum, so that if you get the actual infection, you've got antibodies there that will protect you. And my understanding is in India, you have the Covaxin, and this is a type of spike protein vaccine where you actually deliver directly the antigen into the body of the spike protein on the COVID-19 virus, and that mounts the immune response. So that's one type. The second type is what we call the viral vector vaccine, which is the AZ Oxford vaccine. And I know that's being used widely across the UK, across the Middle East and India as well. So this is where essentially you get the genetic code that will cause the host cell in the body to produce the spike protein. You essentially use the virus. So in the AZ vaccine, it's a weakened form of the adenovirus, which traditionally affects chimpanzees. It's got nothing to do with the chimpanzees other than it's a virus that infects chimpanzees, and it is carried by the adenovirus into the body. What then happens is that adenovirus enters the host cell. The genetic code within the viral vector causes the host cell to produce spike protein on the cell membrane, and that then causes the body's own active immune response to produce the antibody. So it's a very clever way of delivering the genetic code into the body. But the ultimate result is the same. You produce antibodies that protect you. The third type is what we call the mRNA vaccine, which is the Moderna and Pfizer vaccine, which is being used in the UK, across Europe and the Middle East. And this is essentially where you get the mRNA code, and in the form of the Pfizer vaccine, you wrap it around what we call nanolipid particles, and that then gets injected into the body. The mRNA then enters the host cell into the cytoplasm, and then causes the host cell to produce the spike protein on the cell membrane. And that then makes the body think that the COVID-19 virus is in the body. Of course, it's not, it's just the vaccine. That then causes the body to mount an immune response. And ultimately, all three vaccines then lead to antibodies, which provide active immunity. With a lot of the vaccines, there's an initial dose which produces some antibody response, and then there's a supplementary second dose which varies between 3 to 12 weeks, depending on which guidance you follow, and that causes a further enhanced immune response. Now, the efficacy data currently that we have available is that for all those vaccines, somewhere between 70 to 95% of individuals receiving the vaccine will have a sufficient enough immune response that will give them protection without even getting the infection. Now, when you are considering whether you should have the COVID-19 vaccine or not, my advice to you is to consider this. Would you rather have a fulminant, full-on COVID-19 infection, take the risk of the disease process and complication, take the risk of pneumonitis and potentially pneumonia, take the risk of potential breathing difficulties, take the risk of needing oxygen, take the risk of long COVID syndrome, which I'll go into later, take the risk of ICU admission, or would you rather take a safer approach where you deliver the weakened form of the virus into the body that causes the body to produce antibodies? I know what I would do, and this is what I myself did in December when the vaccine became available. I'd seen how serious the infection was amongst youngsters, 20-year-olds, 30-year-olds, and of course the elderly we all know about. And therefore I didn't rest until I received my vaccine, so I had protection. Even though I had an infection last year and I had antibodies in the summer, I didn't want to take any further chances this winter and into this year to have the fulminant infection. So when you're deciding whether to have the vaccine or not, that's essentially the nub of the decision you have to make. Would you rather have an active infection and then get an immunity, or would you rather have a vaccine that actually simulates an active immune response from your body? That's the decision each one of you needs to make following any talk today and subsequently. Brother Abdul Rahman, so that's just introduction to vaccines and the types, inshallah.
That was very well summarized, Dr. Asif. Really lovely to hear that. And one question I had, follow-up question to the fact that you mentioned you had an active infection. And so you had a passive vaccine, you can say, and you had a follow-up vaccination in December. That leads me to the question of variants, virus variants, and how often do we need to vaccinate ourselves against COVID?
Yeah. So as I've mentioned about the different vaccines, the way they work is that they deliver the genetic code and they make the host cell produce a spike protein. What we know with lots of viruses is that due to antigenic shift, the genetic material in every form of the virus. So the virus is very clever. It changes its genetic code so that the body does not recognize the spike protein, so it doesn't have antibodies that could neutralize it. Okay, so some variants, there's obviously crossover between spike proteins, so there's similarities. So for example, we know that the AZ vaccine, it works for the UK variant. We know that other vaccines work well with other variants. What we don't know at the moment, and there's emerging studies awaited, is that all the different variants that are coming out, which vaccines work for which variants. And all I would suggest to the listeners is that right now, you know what vaccines are available. you know what variants are out there in your respective countries. You need to look at local data for protection, for which vaccines work for which variants. And I know in India, the Covaxin, I gather, works for the variant that has been found in India. The AZ, I'm not aware of studies yet for the variants in India. And you should therefore have the vaccine that has the best protection to the variants. Now, the likelihood is that over the coming months, due to the antigenic shift, the virus will change, and therefore the vaccine that was developed initially may not work for the new variants going forward. And it's likely that on an annual basis, you're going to need a booster vaccine dose to simulate the recognized antigen in that time frame. So, for example, in the influenza progress in detail, but the way the influenza essentially get the different strains of influenza, they then do genomic sequencing on that influenza strain, and then they produce the vaccine for the following winter, okay? And clearly every winter, there's going to be a percentage of viruses that don't work with that vaccine. And we know in the UK, for example, anywhere between 50 to 60% of flu vaccines actually are efficacious in patients. About a third of patients end up being flu strains that aren't covered by the vaccine that year. And that's always the way with vaccines. You can't have 100% efficacy with any vaccine. There's always going to be mutations and variants of the virus that don't work for that particular vaccine. But right now, from what we know, the vaccines work for the variants that we have. In time, and the longer you leave it, you will end up with variants that the vaccines don't work for, which is why I know, for example, in the UK, the AZ vaccine, they're currently working on a modified version of the AZ for when we're going to deliver a booster in the UK. So that's an explanation of variants in vaccines.
Thank you, Dr. Asif. To summarize the variants, what we've seen so far, we've seen the Brazilian variant, the South African, the UK, and in India, we've got the Covaxin, which has been at least proclaimed as a one-size-fits-all vaccine, a buffet that can potentially target all three variants and many more that can mutate. Whereas the other vaccines that are available in the UK and in the US are more a la carte, in the sense it's very targeted to one variant. Would you, or even Dr. Nabil, if you can pitch in, about the Covaxin itself, how good is it against, protecting against all the variants that you have out there? Can we believe that it can afford that protection?
Okay, in terms of the AZ vaccine, I'll let Dr. Nabil come in a minute about the Covaxin, but for UK audiences and those in India as well, the initial AstraZeneca, and that stands for AZ, so I'll use AZ going forward, the abbreviation. The randomized controlled trial was of around 24,000 patients across the UK and Brazil for 12 months. And they essentially looked at 11,500 patients. So that was about 7,500 in the UK and 5,000 in Brazil. And they found that in the COVID vaccine cohort, which was about 5,800, versus the control group, which was 5,800, when they compared the vaccine cohort with the control group, there was a nearly 75% efficacy in the vaccinated group. And that was obviously true then of the forms of the virus found then. And we know in UK studies more recently that this AZ vaccine works very well for the UK strain and the Brazilian strain. What we don't know for sure at the moment is how it works with the South Africa strain or the other strains found in other nations in the world. So therefore, right now for UK audiences, the AZ vaccine is very effective for all the variants that we've currently seen in the UK. So that doesn't necessarily affect our guidance for that. In terms of Covaxin, I'll hand over to Brother Nabil to come in there because he knows more about Covaxin.
Right, yeah. Thanks, Dr. Asif, for that. It's not much different to Covaxin, actually. So the main thing to understand regarding Covaxin is an indigenous vaccine from India, made in Hyderabad. It's from a company, homemade company in India, but the biotech. But the main thing is it's different. The vaccine in itself is different compared to the ones you mentioned from AZ or from Pfizer or Moderna, because this vaccine is an inactivated virus. So the virus, imagine a live virus that's been inactivated. It's like a dead virus now that you're putting inside the body. So they're not even injecting a part of the virus. They're taking the proteins of the virus and they're injecting in. So, and also you should remember, I think most of you know, the approval for its usage was given under an emergency act from the Indian government because of the need. So Covaxin has not completed its phase 3 trial. However, I think 2 days ago, there was a report saying that the drug regulatory authority in India have given the permission to step Covaxin out of phase 3 trial, and it will be considered in the same level as AZ at the moment. That's what I heard 2 days ago. However, you should remember that there is no published data of the phase 3 trial. I can share the screen now to show you that of Covaxin. You can see that there is a study in Lancet put on Covaxin, and that is from phase 1 and phase 2 trial only. So from these 2 trials, so there are 3 different phases for a vaccine before it comes out to the public. Okay, ideally speaking. So Covaxin came out as an emergency vaccine, but ideally they should be phase 1, phase 2, and phase 3, which involves thousands of people being involved in the study, and then it comes out to the public. So we have phase 1 and phase 2 report published in Lancet, from which it shows promising results, and the efficacy is about 80%. And hopefully by phase 3 trials, they are hoping that the results would stay the same. And also, we've seen that regarding the question you asked about variations, they have seen some neutralizing activity from few, because the number is not great in phase 2. They have seen some activity with the UK variant. So with the UK variant of the virus, they have seen some activity with Covaxin. Not sure about the other variations so far. And it's still so early to actually talk about all of this. Like Dr. Asif mentioned, it's going to take many more months for us to get a hang around the whole topic of which vaccine is going to be efficacious against what. So the ones which came out early will be able to provide us more studies and more data on it. The ones which come out later will take its own course and time. So that's the summary. The summary would be that it be Covishield from AZ or Covaxin. This is for the audiences in India. I'm saying it doesn't matter at this point. Take either of them, any of them. The important thing is to take your first shot of vaccine.
Thank you, Dr. Nabil. That's really helpful. Well, the general guidance is that prevention is better than cure, and vaccines do help us take that first initial step and get us, insured against COVID, at least initially. Let's go to the next topic about, are these vaccines really safe in the sense the side effects? We've seen a lot of side effects, and a couple of them, for instance, facial paralysis, 1 or 2 deaths that have been reported. What is your general reading in these, Dr. Asif?
Okay, so in terms of safety, I think the speed of the rollout of the vaccines did worry a lot of people. I remember in November, end of last year, people were asking me, are you going to have the vaccine? And I myself was quite concerned about the speed of the rollout. So I did a lot of investigation and studies myself to see exactly what trials had been done, how many people had been vaccinated, and what the complications were. Now, one of the things with any new drug is that what you don't, well, and what is hard to establish early on is causation between the medicine and then the side effect. So generally speaking, I'll give you an example. I take drug A and the next day I start vomiting. What I don't know is, did the drug cause the vomiting, or did I have a concomitant infection with the virus that caused the vomiting? And it's only over time, when you get large numbers, do you then try and see trends in terms of side effects and complications. So what we know with the studies that we've seen around Pfizer and the AZ vaccine, and those are the studies that I've mainly looked at myself, is that both vaccines are very safe. They've all gone through the rigorous process of randomized controlled trials. They've all gone through a regulator approval. So for example, in the UK, they've had MHRA approval. You've had the European regulator approval, and you've had the same in the America. And obviously in India, they've done the regulator approvals. So the regulators scrutinize the evidence and make sure that the vaccines are safe. Now, in terms of side effects, based on what I've told you already about active immunity, there is going to be some side effects in terms of when your body produces the antibody response. And that's why, since we've started vaccinating as well, the commonest side effect that you see in about 70 to 80% is a dull ache in the arm where the injection is given. That's purely down to the localized immune response where the injection goes into the muscle. And that's very common, and that generally subsides within a day or two. The other side effects are short-lived, and they are essentially a body ache, a mild fever, tiredness, and generally these settle within 2 or 3 days. With you may require some paracetamol or fluids, and these side effects settle down. Now, the more serious side effects that have been put out there on social media, there's absolutely no evidence that I've seen of causation between the vaccine and that. So, for example, I remember there was some social media scare stories about Denmark, and about, I think there was 500 people that died in Denmark. Now, in the UK, we delivered nearly 20 million doses of the vaccine in the last 3 months. If there was a large death rate from the vaccine, we would see the evidence of that. Now, in my own vaccination center, we vaccinated over 6,000 people in the last couple of months, and we haven't had a single serious side effect or death. In the UK, actually, we've had the opposite. So since we've been vaccinating, hospitalizations have dropped, death rates have dropped, and there's been no evidence of serious complications. Very early on, I'm sure you heard about the Pfizer vaccine and anaphylaxis, where some people had serious allergic reactions to the Pfizer vaccine. That was essentially 6 people in 1 million that developed anaphylaxis. And there were people who were allergic to the ingredients of the vaccine anyway, or weren't knowingly allergic, but then had the anaphylactic reaction. Now, with any new drug, there's always a very, very small risk of developing an allergic reaction. And that's why now in vaccine centers across the UK and the rest of the world, once you've had your vaccine, you're normally observed for 15 minutes after to make sure that you don't have a serious reaction. Now, based on that information, I think the other thing that people need to consider is, alongside the safety of the vaccine, you also need to think about the effects of the infection if you get it, because you have to weigh up these two things when you're making up your mind. So when you're making up your mind around the safety of the vaccine, you need to think about the things I've just mentioned and the protection that you get versus the risk that you're going to get if you get the virus. And we know that the death rate with the COVID-19 is 3 times deadlier than the flu virus, for example. And we know our communities, Pakistani, Bengali, Indian communities, the BME communities, are more severely affected. There's been reports of death rates around 5 in 100,000. So certainly the consequences of the actual disease, in my view, outweigh any potential risk of any side effect. I would rather take the vaccine and develop a mild ache in my arm than take the risk of getting the infection and getting pneumonitis and pneumonia. I think it's quite a straightforward decision as far as I'm concerned. But I think people just need to consider that. Now, in terms of then safety, I would just sum it up to say that all the vaccines are safe. They've been tested widely. In the UK, we've delivered 20 million doses of vaccine of Pfizer or Oxford. And there's been absolutely no reports of serious effects. Some of you may have read the news this week that some European countries have paused the vaccination of AZ because of some theoretical risk of, again, it comes down to causation, got thrombosis due to the vaccine. Now, the evidence from the UK data is that the rates of thromboembolic disease have not changed even while we've been vaccinating. And therefore, the view from the UK point of view is that the people that have got thromboembolic disease, they were going to get thromboembolic disease anyway, and you can't attribute the thromboembolic disease to the vaccine. But we're monitoring that closely. All I would say is that if you're making a decision around the AZ vaccine, also consider the other risk factors for thromboembolic disease. Are you a smoker? Do you have thrombophilia? Do you have strong family history of thromboembolic disease? Are you immobile for whatever reason? And have an individual discussion then with your family doctor to decide whether you should go ahead with that vaccine or not. But right now, from the information we have, the vaccines are very safe.
Thank you, Dr. Asif. That's really helpful. As a follow-up question here, there are a lot of conspiracy theories about the content of the vaccines itself. I mean, testing on chimpanzees, fecal material, blood from the cow, or even haram substances like alcohol. What are your views on those?
Okay, so I mean, the first thing is it's really important from a Muslim point of view that we ask the people of knowledge if we don't know ourselves. And a lot of people have been following conspiracy theories about vaccine content, and they take at face value the ingredients of the vaccine. So if you log into the gov.uk website in the UK, you'll see a list of ingredients listed for the AZ vaccine. It will list things like chimpanzee adenovirus, fetal cells, and these things. And people automatically assume that they are in the vaccine. In terms of a general summary, and I'll go into the specifics, there's absolutely no haram ingredient in the vaccine. There's no animal product in the vaccine. The vaccines are completely halal and permissible for you to have. If I then go on to each one individually, I think there's a couple of key points that we need to just make here. So a lot of people are concerned about these reports about the aborted fetus within the AZ vaccine. The aborted cell story has come about because when vaccines are made in the laboratory, to have the active ingredients of the vaccine grow and develop, you need what we call host cell lines, okay? The host cell lines are essentially, in the UK with the AZ vaccine, they use host cell lines from what we call the HEK293 cell line, which is a genetically modified cell line from a aborted fetus going back to the 1970s. So the original cell was a aborted fetus, but that was from the 1970s. And the current cell line being used now is a genetic clone of that cell line. And that's because, subhanAllah, the human, even in a laboratory setting, you can't create something from nothing. And only Allah is the creator of something from nothing. As humans, we can't create cells ourselves, so we have to clone them from an original cell line. So the HEK cell line is the genetically modified version of the cell line, but it's not actually the original embryological cells, and there's no human material at all in the final AZ vaccine. And scholars have said that it's completely permissible to have. So it's purely there to help the active ingredients of the vaccine grow. The other thing is then about the animal products. So does it have chimpanzee? Does it have pork? Does it have cow meat or whatever? This has again come about because people don't understand the various forms. So as I mentioned earlier, the AZ vaccine is a viral vector vaccine where the genetic material is carried within the adenovirus, which infects chimpanzee. So other than that, there's no other chimpanzee relation. It's just the adenovirus that infects chimpanzees. There's got no chimpanzee DNA at all. And that is a vector vaccine that is delivered. In terms of pork and cow, there's absolutely no evidence of that at all in any of the vaccine. There's no animal products. It's completely vegan friendly. If you're vegetarian or vegan, there's no problem at all to have the vaccine. In terms of then the alcohol, if you read the AZ ingredients, there's a tiny, tiny form of alcohol used as a solvent to dissolve the contents of the vaccine. And that concentration is a very low concentration at 0.002 milligram, which is less than the alcohol content that you find in natural food. So for example, the bread that you eat every day, do you know that it contains more alcohol than the AZ vaccine? It's a form of alcohol that's completely permissible to consume. It doesn't intoxicate you, it's not haram, and scholars have said it's completely permissible. So you can certainly go ahead with that vaccine, knowing that there's no haram form of alcohol within the vaccine. So that covers the stories around the fetus, the chimpanzee, alcohol. Then there's obviously concern about other ingredients. People have read about formaldehyde or aluminium. Again, let me just say, in terms of formaldehyde, you've got very negligible forms of formaldehyde within the vaccine. And really it's there to stop the vaccine getting infected with microorganisms, so that you don't introduce microorganisms into the body. And you've got less formaldehyde in the vaccine that's found in your bloodstream. In terms of aluminium, the aluminium within the vaccine is the same aluminium that's found within antacids. So for example, some of you may use things like Rennies or other things for indigestion or heartburn. Some of you use some aluminium materials found in dental dentures and dental cement, or even baking powder. And so the aluminium, again, is completely safe. And there's more aluminium in tuna than there is in the vaccine. And again, I think these are all just scare stories that people, what is contents of the main ingredients that I wanted to touch upon. There's clearly other issues that we need to just go through as well. But I'll hand back to Abdul Rahman if there's anything further to add on ingredients.
Thank you very much, Dr. Asif, for that detailed explanation. That was really helpful. I want to actually move on to the next topic in the interest of time about choosing a vaccine itself. I mean, predominantly in India, we've got two choices, Covaxin and Covishield. And the consensus, at least, is Covaxin, the recommendation. But Covishield is the variant that we get from AZ. So how do we choose between these two?
So as we alluded to earlier, the current evidence is that both vaccines are effective, and those people that also have the Pfizer option, Pfizer is also a third option, and there's going to be others. So Johnson & Johnson, Moderna will be available very soon for everybody. So there'll be lots of products out there. I wouldn't necessarily look at the efficacy data at face value. Remember, these aren't head-to-head studies, so you're not comparing one vaccine with another vaccine. You're essentially having different cohorts of patients where you've got a randomized sampling of a vaccine group versus a control group, and you're seeing whether the vaccine is effective. So there's no head-to-head study. So when you see, for example, Covaxin or Pfizer quoting 90%, 95%, you see AZ quoting 73 to 75%. It doesn't mean AZ is 20% less effective. Basically, all it's telling you is that in that sampling group, so for example, Pfizer was tested on 42,000 people, AZ was tested in 23,000 people, and they were completely different cohorts. They were completely different countries they were done. They were completely different age groups. So you don't really know. You don't really know about which vaccine is more effective. All I would say is that all the vaccines that we know so far, they have a degree of effectiveness. We know, for example, in the UK, the AZ vaccine has a huge amount of evidence now, so much so that the French and German authorities reversed the decision of over 65. If you remember, around the new year, when there was a dispute between the UK and the EU about vaccine supply, and at the same time, France and Germany decided to prevent the regulator approving over 65 use. UK data then emerged a couple of weeks ago, which showed more than a 50% reduction in death rates in over 60 to 80 patients, 80-year-old patients. And also hospitalizations have more than halved. Because of that UK data, we know that the AZ vaccine is highly effective. So the study data is just a small, just gives you a small amount of information. What you should also monitor is live up-to-date data. So in the UK, we vaccinated 20 million people now with either Pfizer or AZ. So I would ask people just to keep an eye on actual data that's coming through right now on effectiveness. So then in terms of your India audience, between Covaxin and Covishield, all I would say is that both vaccines appear to be effective. As Dr. Nabil mentioned earlier, we don't really know enough evidence at the moment about which variant is going to be more effective or not. Clearly, there will be bias involved with drug companies pushing their vaccine. What I would be saying is that right to you, because if you refuse one, you may be waiting months and months for the other one. And by the time you have that one, you may have a different variant at that time, and therefore the vaccine becomes less effective. So I would just take the vaccine that is available to you, and inshallah, it will be effective for you.
Thank you, Dr. Asif. And just a smaller question on that. Is it okay to take the vaccine both from Covishield and Covaxin, for instance, with a time gap if they are treating two different variants, or is one sufficient in the follow-up dose?
Yeah, so there's a couple of things there. So you've got to ideally make sure that the first and second doses are the same vaccine. So I wouldn't at the moment mix first and second doses. The other thing that we know from evidence, so just specifically around AZ and Pfizer that I've seen, from the first dose to the second dose, there's an increase of 15 to 20% effectiveness with a further immune response. So one dose is not enough really to give you sufficient protection. What you don't know is, are you in the cohort of patients of the 50% that don't have a sufficient immune response? So therefore, I'd always encourage people to have both doses.
All right. Dr. Nabil, another question related to patients who have pre-existing conditions. What are your thoughts about patients who have diabetes and other conditions? Are they okay to take these vaccines?
Yes. So the priority is given to those who are prone to the illness. So as we know, the people who are prone to illness are those who have high index of comorbidities like diabetes, hypertension, and age is a major factor. Oh, the greater your age, the higher the risk of you getting the infection. So in UK, the strategy was they would start vaccinating all the elderly people first, above 80. And so we had lots of death of people above the age of 80. Also, the age population is, we have above 80 population numbers more in UK. So by default, the deaths were more in that group. And now, as Dr. Asif mentioned, with the vaccine, it's amazing to see the greatest achievement I think we've got so far with the vaccine is that there is a reduction in hospitalization by 80%. It's a study published in BMJ. I'll show that in a while. So that is the greatest achievement, I think. So people above the age of 80. So now someone at 80 years of age, imagine, majority of those, I'm not saying all of the 80-year-olds will have illnesses, but you can imagine an 80-year-old person at some point, many of them would have diabetes, hypertension, and other comorbidities. So they all received the vaccine. Majority of them have received the vaccine. We've moved to the next phase of 60 to 70, and I think we've come down to 50 to 60 years of age, age group now. So they all have received, and we're not talking about one or two. We're not talking about a few hundreds of thousands. We're talking about millions, like Dr. Asim mentioned. So they all have received, and we're not seeing any. So I work in the emergency department. I have not seen anybody coming into the department being affected by the vaccine so massively that it's life-threatening. Yes, the occasional people with a red sore arm or fever. Some of them have chest pain and shortness of breath. But again, that is not because of the vaccine in itself. A lot of these people have other illnesses, like Dr. Asif mentioned. And imagine if you take a small city with 25 million people, imagine. So if 25 million people have been vaccinated, the life still continues. With vaccine or without vaccine, people are still going to become ill. People are still going to die. People are still going to have chest pain. And we can't attribute everything in all of those incidences to the vaccine. So with or without the vaccine, the people are still going to get sick. So that is what I really wanted to put forward, that the vaccine in itself is not going to be harmful for people with diabetes, hypertension, or other things. Yes, we're not giving it to people who are immunocompromised. So when I say immunocompromised, I mean those who are on chemotherapy, whose immune system is really weak, or those sort of high-risk cancer patients. This vaccine is not tested on them for safety reasons. And actually speaking, this is an interesting fact. The whole purpose of vaccination in itself, not just this vaccine, we've been giving for decades, various other vaccines. One of the main purpose of vaccination in itself is to protect those individuals who would catch the virus pretty quick and would die from it really quick, like those people who have a low immunity. So us taking the vaccine is for ourselves, as well as to protect those individuals, because the more and more vaccines we as normal people take, the less we're hoping that eventually we will transmit less of those virus to those people who have cancer or other serious illnesses, or even children who have immunocompromised states. So there is no problem with, for people, in simple answer, I would say there's no problem in taking the vaccine for those who have diabetes and hypertension.
Thank you, Dr. Nabil. One other question related to, religious angle. Ramadan is around the corner, and some of our second doses might be even scheduled for that month while we are fasting. What is your recommendation in terms of taking the vaccine during that month? And also for, as a follow-up to that, people who have hypertension, is it okay for them to take the vaccine during that month?
Sorry, is that to me, Abdurrahman?
Oh, yes, Dr. Asif. I mean, sorry about that.
Okay. No problem. So, in terms of the Islamic viewpoint around, there's two opinions at the moment that I've heard. So you need to, opinions are that one says that it's permissible, and the second says that it breaks the fast. Now, the majority opinion that I've heard, which I follow, is that it doesn't break the fast, just like any other injection that you have, as long as it's not nutritious and it's not something that enters the stomach. There's no reason why it would break your fast. And similarly, like you have blood tests and other things while you're fasting, which don't break your fast. So my viewpoint on that is that it doesn't break the fast, but certainly just to make sure that you're set. Secondly, the question around hypertension and other things. All I would say is, brothers and sisters, anybody who's having the COVID vaccine during Ramadan, so based on some of the effects that I've mentioned to you, and that's where you may get a mild fever, body ache, etc. I think the sensible thing to do is before you close your suhoor on the day after the vaccine, I would suggest taking some paracetamol as a precaution, because the fast will last 16 to 18 hours. And if you're then getting tired and a headache and a mild fever, it could potentially be very difficult for you to fast for the whole day as well. And in certain areas like the Middle East and India, where it's going to be very hot as well, the risk of dehydration is also increased. So you just need to be a lot more careful about the amount of fluids you drink between iftar and suhoor during Ramadan. And then in hypertensive patients, there's no reason why you couldn't carry on your medication as normal. And you would just take the normal precautions that you do any other time. So you make sure that your blood pressure is monitored. You've got to make sure that you don't become fluid depleted, so that you don't become hypotensive or dizzy. And therefore, if you're noticing that your blood pressure is dropping during the fasting months, you need to, again, consult your doctor and adjust your medication. Some people need to reduce their medication or split the dose accordingly. So seek medical advice, inshallah, around that. And the same goes also with diabetic patients. Lots of you within our communities are diabetic. And again, you need to adjust your diabetes medication when you fast, especially because your eating routine is changed. So you should do that as well.
I just wanted to add to that. Yes, with the Ramadan and vaccination, I think there have been many questions on this even in the past, which have been put forward to the fatwa committees across the world. And from what I've read, that majority of the fatwa committees in Saudi Arabia and other places have given the permission that you can take vaccines as long as they're injectable, like IM injections, and they're not orally taken, we don't have vaccines that are orally given, mostly for adults. So as long as they're injectable, it's all right during your fasts.
Thank you, Dr. Asif and Dr. Nabil. I think we're just running above the time limit.
Yeah. I think we can extend a little bit more for people to pitch in if they have questions.
Yeah, I was just, I don't know what questions you got lined up. I'm just thinking for the sisters, we should just cover fertility and DNA. I think that's important.
Yes, Dr. Asif, you can go ahead. I think once you've done that, I'll put up a summary of those slides after you finish that. Yep. Okay, so obviously for the sisters, there's concern about fertility, and the way I would look at that is I went to the source of the conspiracy around fertility. So I did a lot of research on this because
a lot of my own community and patients were asking me about fertility. So my evidence, when I followed the trail back, the fertility myth started from a German epidemiologist, and his name is Wolfgang Wodardt. You can type his name into Google and you'll get the full story. And he postulated that COVID vaccine may cause the body to produce an antibody called the anti-Synectin-1 antibody. And essentially what he said was that the Synectin-1 antibody, the Synectin-1 protein shared a similar genetic code to the COVID spike protein. So he postulated a theory that if you inject the body with a vaccine with the anti-Synectin-1 antibody, it may cause the body to reject the human placenta, and that would then make the human taking the vaccine infertile. Now, there's been lots of counter discussions about this. So firstly, is that the genetic code between Synectin-1 and the COVID spike protein are not the same. They may share a very small sequence that's similar, but overall the sequence is not the same. And therefore, to say that the vaccine produces anti-Synectin-1 antibodies that will make the body reject the human placenta, I think is false. The other one to bear in mind is that 12 women who had the Pfizer vaccine became pregnant. So if it was going to cause infertility, then those women became pregnant and they've had no problems at all. Thirdly, the European regulator and the MHRA have dismissed the claims of Wolfgang Wodardt, and the Royal College of Obs and Gynae in the UK have issued guidance saying that it's completely safe for women to have the vaccine and there's no effect on fertility. And they've also concluded that there's no biologically plausible mechanism by which current vaccines would cause a woman's fertility to decline. I've therefore advised all the sisters that have sought advice from me to go ahead with the vaccine. I don't believe that it impacts on fertility. My own daughter, who has asthma, she's had the vaccine, and I've said there's no problem. She's only in her 20s, so I firmly believe it's safe. So that's why I've said even to my daughter to go ahead and have the vaccine. In terms of DNA, so the DNA myth, I think, again, comes from people that don't fully understand the way vaccines work. So as I mentioned to you, the Pfizer-Mrna vaccine is an mRNA messenger RNA vaccine. It's got absolutely nothing to do with DNA. So the mRNA enters a cell. It doesn't enter the nucleus. It stays within the cytoplasm. And it's basically a messenger RNA of the genetic code, which then causes the body to produce the spike protein on the host cell. It doesn't change the DNA. Once the mRNA is within the cytoplasm, it then disintegrates and is then not passed on to anyone. There's absolutely no way of that affecting your DNA or passing it on to your offspring. The whole theory around DNA change is completely impossible to do. And I certainly wouldn't be worried about that at all. So in summary, the vaccines don't affect fertility. The vaccines don't alter your DNA. And as I said earlier, the vaccines are completely halal. They have no animal products. And as far as I'm concerned, they're safe to take. Jazakallah khair.
Thank you, Dr. Asif. Very helpful insights. Dr. Nabil, you had a few slides to share in the conclusion about the details of COVID-19 and the vaccines. Would you like to present? I think you're on mute.
Sorry. Yep. Jazakallah khair, Dr. Asif, for explaining that really important subject to cover. So I thought I would do a bit of a slide share now to summarize a few things, which I thought could be useful for people. So the main aim of this talk is not just about COVID vaccine, but also to make people aware about the vaccine in itself, that there are so many other vaccines, and there are anti-vaxxers in the community, even a large number of people in our own community who are against vaccines, which is actually, it's a challenge when you're trying to do a collaborative effort in the society, when some people don't do and the others do, and then because of those some people, the disease still continues to progress in the community. So I thought I'll just do a quick slide share if we have a little bit of time. All right, so we covered a few things about the vaccine in itself. So this was just a slide to show that the ingredients of the vaccine in itself is halal. There is no issue with the ingredients in the vaccine. It's just got some water and some adjuvants and a very, very trace amount of formaldehyde or alcohol. So I don't want to go into the details of vaccines. We've already spoken, but there are different vaccines being produced at the moment. I can share these slides with you through the chat box soon, inshallah. And there are different vaccines being produced for COVID. And Dr. Asif has already mentioned how the vaccines work. Again, it's a detailed process. We don't want to get into the molecular level of how it works, but in simple terms, there are multiple ways a cell can be sort of triggered to produce immunity through vaccination. And alhamdulillah, I think the way Allah has produced the immune system for us, there are many ways to utilize it through vaccines. These are some of the vaccines which are already on the go. Like we said, the other thing is that some of these vaccines, other than Pfizer and Moderna, all the remaining vaccines which are there right now in the pipeline, or which are already been out, and which are out in the community, have an equivalent in the past, like the viral vector. They are like Ebola vaccines, hepatitis B vaccines, and the vaccines that you give to your children. They all are similar to the vaccines which are produced now for COVID, except RNA vaccines. That is something completely new. And we've discussed about how they work. We discussed about how the Moderna vaccines, Pfizer vaccines as an mRNA vaccine work. We also discussed about the AZ vaccine. And the famous question was about COVID vaccines and why is it difficult to compare? Now, I was reading about it, and there are many articles been written about it. One from Nature. Nature is a well-known sort of journal, and in that there was a topic about this, and they said it's really too early to talk about these things at the moment. We need many more months to actually see what happens in the real world, and then compare the data to show which vaccine is better compared to the other in terms of immunity. So it will take some time, and people need to be patient and understand that this takes time. And we mentioned that the greatest achievement so far is that the admission rates have fallen by 80% in over 80s. This is in the UK. And I'm sure that is the same case, that this will be the similar case all around the world. The greatest achievement would be for the vaccines to reduce hospital admission. And we saw Covaxin, that it is it's already published in Lancet. And once the phase 3 trial is finished completely, they will publish that data as well in Lancet. And then we'll have sort of clearer picture of what and how efficacious it is. A small picture to show, I'm not sure if you will be able to understand this. There have been great pandemics in the past. We've had the Spanish flu more than 100 years ago. We've had the Asian flu, we had Ebola and other things. But if you see the time scale from here, 1920 all the way, look at the time it takes to produce a vaccine. It takes a long time. Okay, it's not an easy process. It takes years and years and years of process to get a vaccine out in public. And if you come down here to COVID-19, you see how this was we were able to achieve this within a year. And this is the only vaccine that's come out so quick in our sort of history of vaccinations. The one before this, the record before this was 4 years for mumps virus. And that came out in 4 years, but this came out less than a year. So you can understand that, this is all in the early stages of vaccination program. And we've achieved already so much with this. So we should be thankful for the blessing we've got. And, we should look at the larger picture and understand that this is in itself a great achievement. It's again, another sort of a picture to explain that, these are the different phases that a vaccine goes through. It goes in animal studies, human trials, large clinical trials, and, rollout and eradication. And so in 2020, we've, sort of cut short all of these stages in within 8 or 9 months. And vaccines in general, okay, this is for all the mothers and all the people who are generally concerned about vaccines for the children. Remember that they've always saved lives, okay, in millions, and it's literally in millions actually. So there's plenty of data from WHO and from other places. You can see how many lives have been saved, okay, every year, every decade, over decade, by increasing vaccination. Currently, this is the world map. Currently, you can see the dark green areas are the places where maximum vaccination has happened so far for COVID-19, and the rest of the world is catching up slowly. But this is indeed a global effort, and the more and more countries start vaccinating their individuals, the sooner we'll be able to sort of come out of this pandemic. So in 1980, smallpox was declared as an eradicated disease. And I'm not quite sure if there was a debate that if we can do the same with COVID-19, we can't, it's unlikely that we'll eradicate it. This will stay with us for a long term, but it might turn into something like a flu illness that happens yearly. And like Dr. Asif mentioned, we might need a yearly flu shot, but it's unlikely that we'll be able to eradicate it like smallpox. For those people who want to know what are the different vaccines out there, so currently in phase 3 and 4, as we know, all the green ones on the screen here are phase 4 vaccines. So we got, the Mrna Vaccine, the AZ vaccine, and we got some the Pfizer and the Oxford vaccines, as well as some vaccines from China are coming out in phase 4. And there are others. You can see there are so many other vaccines being prepared. They're in the phase 1 and phase 2 development. Around 80 odd, so 80, I think, odd companies are on currently doing sort of researching in phase 1 and phase 2 trials. So there are plenty more coming up. And as in more we see more vaccines coming out, we will get a clearer picture of what, and how it works. A side note, I just wanted to give on this. Okay, it's really important, and someone who works in the community, like Dr. Asif, will definitely know much more about this. That the importance of childhood vaccination, like measles, and measles is a deadly disease in children. Its infectivity is around 30%, much higher than COVID. Okay, and it can be deadly for children. You'll be surprised that we were very good at controlling measles up until 2013 or 12. And then we started becoming lax with it for many other reasons. And there was a resurgence of it. There was a new wave of measles case in 2018 or 2019, which saw a lot of patients. People who've not seen any of those sick children in ICU, people started seeing them, including the hospital I was talking to recently in Southampton here. A pediatric ICU consultant was telling that during his sort of 15 odd years, he's never seen a child admitted with measles in the ICU, but he saw around 6 to 7 really sick children. That is all because the community in itself has failed to vaccinate. And there were a lot of anti-vaccination campaigns going about not vaccinating children. Same old stories. They will get autism, they will have issues, fertility issues, this, that, and lots of other age-old arguments, which are all disproven. None of them is true. This has been happening for decades. So we could see an immediate effect the moment people stopped vaccinating, the moment the herd immunity became less than 80% or 80 to 90%, which measles need 90%, 90 to 95% of herd immunity. We started seeing cases in the hospital. And this is an example to show that how important it is as a community to increase vaccination. And in India, you can see how we sort of came across polio. Polio was a very, very common disease, and many people are crippled or dead in the early 1980s, which drastically reduced. And we've almost gone to nil, almost like eradicating polio currently. That's all because of the mass immunization programs. So like we say, hopefully we hope that this is from nature again. We hope that in the future, a pandemic will reduce to an endemic. So there'll be few areas in the world, hopefully, inshallah, with increasing in vaccination, we will control it. I like this quote, interestingly. Someone said that, if you let the virus just spread without the vaccines, this is going to take probably years and decades to reach that herd immunity, which is going to be at the cost of millions of lives, millions of deaths. Either we do that or take the path of vaccination, and we can cut short that number of years process to a few years probably to achieve that early herd immunity. This is another reason why vaccinations are not achievable in our society. A couple of reasons. In a summary, I just wanted to bring out an Islamic perspective of it, that we have various evidences from the Quran and Sunnah to seek cure. And the Prophet ﷺ has encouraged us to seek cure as long as it is halal. So as we know from famous hadith, that Allah, for every disease that Allah has made, there is a cure for it. And I'll share this slide, inshallah. And also there is a fatwa which I wanted to share. This is from Sheikh Abdulaziz ibn Baz. He was the late Mufti of Saudi Arabia, as well as he was the president of World Muslim League in the past. And he's given a detailed sort of fatwa on vaccinations. He's clearly mentioning that there's nothing wrong with it. As a final quote, there are a few words of wisdom from one of the early scholars, Ibn al-Qayyim, rahimahullah, who said, about medical treatment in general, okay, a lot of people have an issue with this. So this does not contradict tawakkul upon Allah. Ignoring these means is a sign of helplessness. So if you notice those words, he's saying ignoring the sign of helplessness, that goes against the true essence of tawakkul. So not taking the means of treatment or cure is going against the essence of tawakkul in itself. If you have to take both side by side, and you have definitely place your trust upon Allah, but also take the means. I think I'll stop sharing that with this. Okay, Abdurrahman, I hand it over back to you now. Abdurrahman, are you able to hear me?
Yes. Oh, sorry, I was muted, I guess. I was speaking, but muted.
Oh, yeah, sorry. Okay.
Yeah. So what I was mentioning is you had a lot of content there, Dr. Nabil, that was really amazing. And I think it can pretty much cover for a series of talks on just vaccines and the depth of knowledge that you've got there. So thank you so much. And again, pointing out those hadiths, it's very helpful and reinforcing for us to go in this path down, trying out the vaccines. So in conclusion, Dr. Asif, Dr. Nabil, Dr. Sundus, thank you very much for taking out the time to present, share your views, your thoughts today. Dr. Asif, you wanted to add something? It looked like you had something to share.
No, I just wanted to thank the audience really for taking up the time to listen. Clearly, you all have an interest in the vaccine. You want to do the right thing for yourself and your families. What I would conclude to say is that you've heard the different evidences and the different things that we mentioned. Now it's really about you making an informed decision for yourself. This isn't a way of forcing anybody to take the vaccine, but it's about considering your individual risks and you're making your own decisions for yourself. And then pray to Allah that it works for you and it's the right thing for you. That's what I'd wanted to end with there. Thank you, Abdurrahman.
Thank you, Doctor. Dr. Nabil, did you have any words of conclusion?
It's pretty much the same as Dr. Asif mentioned. It's to have the reliance upon Allah and go for the means. Currently, this is the cure we have for COVID at the moment. There is no other magic bullet in the hospital that you will get once you get COVID. We can support treatment in ICU and also in the other places, but trust me, like Dr. Asif mentioned, you don't want to take that path. It's really painful if you want to go to hospital, get admitted and get treated. But the best way is prevention at the moment. So you should probably, consider getting vaccinated for the greater good. So as everyone's on the line, I think, as I promised, I think I should share I wanted to share a few of these links and the PowerPoint to the participants so they can download it. I'll do that through the chat. And if they can, it'll be better to download it from the chat box, or else we can, email it to them. But then I think this would be easier. Just hold on for a moment. I also like to thank Sister Sundus for being very active in the chat box. She's done an amazing job of actually trying to answer most of the questions. Thanks a lot, sister. I think she's provided some valuable advices there.
And would these links be available after the chat? I mean, once the session ends, or?
We can. I think you can download the chat box if they want to in their own computers. You can go to the options below and just copy them.
Nabil bhai, we will post it on the website, our RICAC website, along with the recording.
Do you want to post it?
Yeah.
Okay.
Yeah.
We'll do that for her. No problem. I'm unable to share it in the chat box, so I think probably I'll post it in the website, or we can get it to all of you some way, inshallah.
All right. So thank you everyone for joining us today again. And if you have any further questions, please feel free to message us via the website, and we try our best to connect again with Dr. Asif and Dr. Nabil and get those answers. Thank you so much and have a great evening ahead. Assalamu alaikum warahmatullahi wabarakatuh.
Alaikum assalam wa rahmatullah.